Right, good. This is the second part to when I was a partner in a practice in Bristol called Broadwalk. I'll just see if I can share my screen. This is about my fourth attempt to do this. Oh, there we go. Okay, I'm still sharing. So yeah, and like before, I'm just going to waffle through it. I'm not sure if anyone will ever see these. So it's, but I have got it on Keynote. And so these are little reminders. But this is me, and this would be 1989. Oh, it says there, 1989. That's me in the middle, not the one on the right. Yeah, this is in Kathmandu. Yeah, and I took 3 months off. Right. So this is my main bit of advice. If you want to go traveling, do it when you're young or do it when you're old. And yeah, I took 3 months off. And I'm never great on finance. All I know is when I kept ringing my brother every 2 weeks, asking if I'd gone bust yet. And I just booked a return flight. Yeah, it was my honeymoon, the first one. Let's not go there. And yeah, I was trying to blend in. I looked really rough. And the reason I put this in, I just put it a moment ago, is that I had a locum in, and the locum was a lovely guy, and he was a consultant oral surgeon, and I think he'd just retired. And so I don't know how I got to know him, but yeah, he was not great at doing fillings. He wasn't great with, he'd never worked in practice for like 20 years. But what he was fantastic at was taking out wisdom teeth. And so when I come back, if in the notes he'd taken out a wisdom tooth, invariably the lower, I thought, fantastic. That's something I don't have to bother with. And of course, now we'd wait till he had symptoms. So subsequently, half my patients had already lost their wisdom teeth. I never got much experience. And my experience was if I took out the top ones first, then the lower ones rarely give any trouble. And I'm not sure if that's taught or not, but if a tooth's redundant, I used to just take them out. I'm really good at taking out the uppers, like everybody. Lowers can be a bit more problematic. Anyway, I come back and yeah, many thanks to him for doing that. We all are good at one thing or another, but we're not good at everything. And yeah, I went back to India, and that's when I got stuck during COVID. So I had a bit more money then, stayed in hotels as opposed to huts. And so the reason I put this up is this is just a reflection of what we used to do. So I kind of remember now. So back in the day, when you were on call, I think I mentioned this in the last one, we did what was called AAA. So that was amoxicillin, antibiotic. With me, unless they were allergic, it was always amoxicillin. And yeah, analgesics. So I think sometimes I didn't prescribe much, to be honest. And yeah, and advice. And you'd say, come back. And they didn't. It'd be rare that someone on a Saturday that you saw on a Saturday or a Sunday when you're on your own, you'd make an appointment for them, but a lot of the time they didn't come back. And we need to know if that was a good or a bad thing. So yeah, so this I'll probably come back to that. But this was when I was in India, and a friend of mine who worked in ENT sent me some messages because he was worried, and he would be worried because 2 of his colleagues had died through COVID, and he was an ENT surgeon. And we need to follow up on that. So I'm not sure where the slide's going. Yeah, I'm just relating to patient. So this patient I saw back, well, it would have been in the 1986, I guess, around that time. And following the experience I'd had in the high street, I decided not to take these teeth out or re-root fill them. A picture on the top left, that was taken with my first camera. And often you find, when we talk about notes, digital notes don't always transfer very well. And I can't remember the name. I'm not sure if this one was the Durr camera, but you can see it's a bit elongated. but that was the patient's teeth at the time. I changed my camera, as you can see there, but it also shows that every now and again she'd get a sinus, and I kept telling her to pop it because, yeah, she was exempt, and she didn't want to lose. She didn't want dentures. She wasn't in any great pain. And actually, we probably had the discussion, can I just have some antibiotics? And in the end, I stopped giving them. Yeah, and she still got her teeth. Apart from that, you can see that they're not great, but this is, because we've got digital x-rays now, it's a lot easier to reflect on what you did, compared to, 20 years ago, when we'd be rooting around looking for those little bits of plastic. So if you look closely, there's an awful lot going on. But yeah, so I treated her for 30 years, and I only ever I think I took out 2 teeth. One was a central, and then I made that temporary acrylic bridge that's been temporary for, well, it was 8 years till left 3 years ago. And this is just something else showing I did a few of these Marylands, and clearly this isn't great. But, again, that's been there. Ooh, I took out there. So that's been there 30 odd years. And it was an immediate Maryland. And I couldn't understand why she had an abscess on her front tooth. When we took it out, we tried everything, ended up taking it out, and it had a massive groove along one of the roots, and that was where she was getting all these infections. So she had a really narrow, very deep pocket, and it wasn't until I took it out that I knew what it was. And yeah, these pictures aren't great, and actually, if I'd whitened the teeth and tidied up the composite, but as I was saying, I worked mainly in the health service, so it's sort of quickly in, quickly out. Yeah, so going back to the previous one, when we used to see people and do, well, didn't do anything, just give antibiotics. But if you did root fillings, they'd come in, and often they come in with discomfort. And to be honest, there were a couple of things that I did, is if they were biting together and it was uncomfortable, I'd adjust the occlusion. Now, I know lots of people throwing up their hands in horror, but actually, when you think about it, sometimes the temporary crowns weren't as big as they should have been, and so it might have been over eruption. And sometimes the crowns were just too big. And yeah, then you had intrusion. So if you've got a tooth that's infected and it's pushed up through the socket, it needs a little bit of help. And so adjusting the occlusion on a tooth that's flared up, I don't see a problem with that. It's a lot better than having a space. And when you fit a crown that's a bit big, we used to just say, oh, it'll settle in. And invariably they did. And, this was on the health service. You didn't have like an hour to go through all the excursions and, tap, tap, tap away. So, but what it was about here is that it does actually, on Cochrane, it does mention antibiotics and root fillings. If you look, there's how many papers? About 17 papers I found when I typed in, what was it? Antibiotics and root fillings. Later on, there's a different one. And these are just some of the root fillings that we did. And I'm not sure on a couple of patients, and I don't think it's this one. It may have been, but I did a few hemisections when you take out the palatal root. And these teeth just lasted a long time, Yeah, and some of them I didn't even replace the crown, some of this stuff was last stitch, but they lasted an awful long time. Not all. And this one, I remember this because the root was broken. We kept sticking the crown back in. I'm not sure if there's another one. But what was interesting, this patient, you can see the mark there, I'd referred to an implant chap, and she had some really poor experience. She had really bad reaction. She was in a lot of discomfort. She had a lot of swelling, and she never had the implants placed on this side. This is the right side. And, in the end, I had to say to I think this root has had it. So, and clearly it had. You can see there's just like a lot of cement, and yeah, it wasn't great. That was the second time I'd root filled a tooth. because it started to resorb. So I was, getting a bit desperate. And these, so now this doesn't look great, does it? But I know there's this woman I saw in Broadwalk, and when I saw her, the last time I saw her would have been, 2001, right? She still had these crowns. Now, one of the interesting things about this is that I never did the work. I didn't think I could improve on it. I certainly wasn't going to increase my number of apicectomies for her. And she wasn't having any problems. And she probably wasn't having any problems because opposing these teeth was a denture. So, it's common sense, really. What I'm trying to say is don't dive in. Yeah, and this is just something similar. I think this is a guy. Yeah, well, clearly this isn't Broadwalk at all. I don't know why I put this one in, but you can see somehow he'd fractured the tooth. And the other one that's got a line in it, that was kind of just an enamel defect. Never quite sure what happened. That's it. And so I did just, again, this chap was exempt. He couldn't afford an implant, didn't want a denture. And even though when the tooth fractured, it was about 4 millimeters subgingivally palatally, we had to go. And again, he hasn't got a denture, or he didn't have 7 years later, didn't have a brilliant crown, and he wasn't bothered about the other tooth. Not everybody wants a perfect smile. And he was really chuffed that he didn't have a denture. So going back to the thing about COVID, during COVID, we did the AAA. And if you go into Cochrane, which you always should, it makes interesting reading, even though the outcomes that you think you're going to get aren't what you'd expect. So looking up to see a review, really post-COVID on, how people have responded to antibiotics, analgesics, and advice. How many come back? Were they better off? And we don't know. So we spent 30 billion on track and trace, I think. Certainly a lot more than we're clearly going to spend on follow-up. And if you're going to do research and, talking about antibiotics, I think we need to rethink on how we do antibiotics, if we do them at all. And my view is we should do lots of them. And we just need to educate the patients that sometimes they don't get the best outcomes. So I'll do a separate video on that, and I'll try and make that a little bit more professional. And so this is thrown in because art. So I started doing art. I remember that we got Dirac then. So that's the first kind of compomer that came out. And because it was white and it, sort of had a bit of fluoride in, clearly they started to use it. And they didn't last long, but they needed to last long enough. And years later, we got told about, atraumatic restorative therapy. Well, especially for children who'd be doing it for years. And a lot of stuff that we do in practice, the academics have to follow up. There's one on flexible dentures, and I remember going specifically to find out about flexible dentures, again, a few years later, and the chap giving the talk had never fitted one. And he asked me what I thought. The way that you work now and the way that you learn, you've got to look outside the normal routes and start thinking for yourself and how these materials work, because a lot of the advice that we're given is kind of follow-up advice. So, oh yeah, you can see here, well, that was 96. So I was definitely, Grimes, I was up in 96. Oh no, it's track of time. It was 96. I just moved to the squat practice had set up, but we were using Dirac then. And for the children, but triage, I'm not sure when this came out. You probably call it something different, but I used to always call it triage or Fuji 7. And as it says on the little advert, it has an awful lot of fluoride in it. And so if I couldn't isolate the tooth, and if it was a child, and you got to get in quick with children, and you got to play a game with them and all kinds of different things. There's a dentist who's got a fantastic website, McLean. I can't remember her first name, but she dresses up as a cat, you know, because obviously she's in the States, but she does some fantastic work and has some great advice. And she talks about silver diamine fluoride. She's been doing it for ages, as of the Japanese. You know, we should be doing it here. But if I had a difficult child, or if I couldn't isolate a six, particularly, you know, long enough, I'd use the triage. And this seems to work well. And it worked well for, you know, for long enough until you got better cooperation, or it just wore out, and like a sealant, the hygiene had improved and they didn't need anything else. You know, I rarely replaced sealants once they got to a certain age. Oh, and this is, I'm not sure if this will play. Oh yeah, so this is a video that I made, and yeah, it's not much of a video, but the thing was, it was trying to explain Biome toothpaste. Now, the chat, was it the chat before? No, it wasn't the chat before, was it? Yeah, I think that was the same guy. I can't remember his name now. Tim, someone from King's, and or St. Mary's, and they've developed Biomin. So it used Novamin. They use Biomin. I think you get Novamin and Sensodyne. It's that way or the other. But on it, it has the same sticky substance as you get in triage, which stays really well on the teeth. So this is in the toothpaste. It also has the salivary minerals. It's difficult to know if it does what it says, but certainly all your experience would say, I think this will work. So certainly for people who have dry mouths, poor oral hygiene, or just, you know, old, then I think this is well worth using. And there was another guy, Professor Walls from Dundee, and he gave a talk saying how the salivary content had changed as you get older. And so if you didn't have this, along with Durafat, you should use Sensodyne Complete. Now, there was a product called Climpro, and that's available in the States, Climpro 5000. Why it's not available in this country, I don't know, but you can import it, but you don't need to import Biomin. And I think this is a great toothpaste. A bit expensive, but it's great. Yeah, so you can read that. I can't remember what I put in now. Oh, yeah, I can see at the bottom. It was just saying what I said before. That there's doing ideal treatment and doing adequate treatment, and you don't really lose the cooperation of a child. One of the reasons we have so many problems with people being afraid of the dentist, I mean, this is, you know, we did it for I did it for 30 years. You're still getting people come in who are scared, and because they've had a bad experience. It takes a lot to turn them around. Using the right materials at the right age. I mean, the ideal thing is we don't use any materials at a certain age because they don't need it. There's nothing better than the teeth you're born with. And those that aren't that fortunate, you'll have a career looking after them. I'm hoping to live another 40 years. Maybe not. But, you know, someone's got to look after me. Oh, yeah. And I think what's this? This is just to show that, I do other stuff as well. And at the time, I played football for this team. We won the Bristol, Gloucester and Somerset Amateur Cup. We were the last team to play at what was the Bristol Rovers ground before it became IKEA. And yeah, just to confuse you, I had hair then, and yeah, we won everything. So we won the Avon Premier League and then Gloucester and Somerset Amateur Cup. I used to turn up on a motorbike. Never was really sure we were playing. It was always a panic to find out where I was playing. Oh, and I used to train twice a week, and that's what kept me sane, I think, because when I was, I was struggling the first few years at work. And then, yeah, I started here, as you can see, 1995. So we still had record cards to a degree. But went computerized really quite early. We'd all played around with computers, and I'll probably talk about it somewhere else, but we had a great, a hygienist kept saying that her other, so say boss, was developing, he was developing a computer program for dentistry. And I thought, oh, it's going to be, I'm trying to do that. It's going to be garbage, We were all just playing around with databases. Anyway, it was brilliant. It was the first time that we started using a mouse on computers. And it was written directly into Windows. And that was novel because back then there was like an interface between DOS, which you probably haven't heard of, and it was great. And so I used it for about 5 or 6 years, and then it got taken over by another company, and that company is one of the biggest companies. And what you have is when you transfer data, you can do it in a variety of ways, as I'm sure you know. But I remember there were ASCII files, and we were transferring all our data using ASCII files into the one pretty exactly. And yeah, they never transferred. Now, can you imagine if your notes weren't there and you're at the GDC saying, oh, actually, I've lost my notes? You'd have to be an MP to get away with that, not a dentist. You'd never get away with it. I think if they could find of anything better than strike you off, they would. It's just nuts, isn't it? Is that as an individual, we haven't got a leg to stand on. If you're a big business, well, do what you like. But big businesses are worried about their brand, and that's all they're worried about. And they'll throw you under the bus rather than have anyone upset their brand. They're not all like that, but clearly, I'm not happy about the ones I worked for. And as for the NHS, I'll do a different video on that because 10 years after I started this practice, I think the common term is they screwed you big time. And if I wasn't so resilient, I have such a bad memory. I certainly could have been one of those awful cases. But I'll definitely make a video on that. Anyway, I hope someone watches this, and if you do, give me your feedback. And clearly, I can go over the slides again. I'll keep the slides, and I might get better at talking.